Thank you very much, Ron, and it's good to be here with you. First of all, let me just say that had I actually worked to pass the Violence Against Women Act in 1964, I would have been 6 years old, and I am a fierce advocate even at 6. And I wear well, don't you think? Good morning. It is once again really great to be here with you, and to be here with you at this time that is unlike 2 years ago. Different in terms of where we are in implementing health care, but really we have to steel ourselves for the fight, and we know that we have a fight. I describe us as being in kind of the dip phase, right? You heard from the Secretary, and I'm with you. I want her on, as long as possible to implement this health care law. She's been doing a fantastic job, and we have to shore up her leadership, the leadership of the President, and we thank our leaders, Nancy Pelosi and Harry Reid, for making sure that we stay in the fight for affordable health care. But we're in this kind of dip phase, and what does that mean? It means we're in defense, implementation, and protection. We have to defend the law from these scurrilous attacks on the Affordable Care Act. We have to make sure that we defend against the attacks coming out of the Supreme coming potentially from our court system and those who are going to use our courts to try to undermine the law. And we have to defend against the attacks that are coming right out of Congress almost every single week. Thank goodness we're only in session 5 days in the month of January, because otherwise every other day would have been another attack on our health care laws. And so we have to do that. We have to implement. We know across the country and in every single one of our states, we really are in the process of implementation. And we have to be vigilant, and you know that as advocates, vigilant about how we implement the law, because what we do now will set the tone for where we'll be over the next couple of decades, even as we're all still out there working for additional reforms. And we have to protect. We have to protect against those who would use the health care law to undermine Social Security, Medicare, and Medicaid, the kinds of protections that so many of us rely on, both as a safety net and also because it shores up our health care system. So we have a lot of work to do, and I'm excited to do it, because every single time there are some folks who go onto the floor to attack the Affordable Care Act, I want to be right there behind them saying, no, you don't, because are you going to be the ones to take away health insurance for all those up to 26-year-olds who are out there like my son, who potentially would go without health care were it not for the fact that we now allow them to be able to stay on their parents' health care plans? I have to tell you, I go all through my congressional district, and I've been around the country, and all you have to do in a room, especially a room full of parents, because we know our young people, we know that even if they had the money, they wouldn't necessarily say they're going to spend it on health care. Why is that? Because they think they're going to be well forever and that they're going to live forever. And so we know our young people, and when I say to audiences, how many of you have young people who've just come out of high school and college and are on their own and need health care, and now you can keep them on their health care plan, and the parents raise their hands, and you know what? After they raise their hands, they go like this, because they're so excited that they don't have to worry about whether their young people are going to be sick, and then they have to dip into their own pockets and mortgage their homes for health care. We still have some gaps that we need to fill. We also know that young people now, of course, are not allowed to be excluded because of pre-existing conditions. This is a good thing, and we cannot wait until the full implementation so that doesn't just apply to those who reach age 18, but it applies to all the rest of us too. We have a lot of work to do to protect and to implement and to defend. We have work to do as well to make sure that these attacks on Social Security and Medicare and Medicaid are not allowed. I mean, who are these people that think that they can go out and rip a social safety net that we've developed over decades to protect the American people because they want to dump money into a private insurance system that doesn't really work for people? It's not fair. And I know that in this room and these advocates all across the country, we are not going to let that happen. And so, we've got When I think about the challenges ahead and I look out at this room, and where are Marylanders here? I want to know who you are. All right, I want to know that, because I know that in Maryland, and I see one right back there too, so we can fill the room. Little state, but fill the room. But what I know is that in my state, we happen to have a governor and a General Assembly, and you're going to hear from our Governor O'Malley today, that is in the business of implementing, not in the business of destroying. We need governors like that all across this country, and I'm excited that we have one in the state of Maryland. I'm also excited that in my state and in states across the country, because of what I led along with Jan Schakowsky, and you will hear from her later on, we led the efforts in the Congress to make sure that insurance commissioners around the country have the ability to look at premium rate increases that insurance companies are exacting on consumers, to evaluate those, to see if they're justified, to check whether they're excessive, and if they are, then they can say, no, 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 you cannot do that to consumers. And that's because of what we championed in the Affordable Care Act. Insurance commissioners all across the country have the ability to really examine and hold insurance companies accountable. And already we know that in a number of states, including California and Connecticut and Oregon and North Carolina and Rhode Island and North Dakota, all across this country, millions of dollars have been saved, millions of dollars have been returned to consumers because of a tiny little provision in the big Affordable Care Act. And so, you know what? I don't really care if anybody tells us that it was really big. It should have been big because the problem was really big. And that's one of the things that we were able to fix. And so I want to close by just saying to you that there is still so much work to be done. And as I said before, there's almost not a single day that we are in the Congress, whether we're in or out of session, that somebody doesn't come up with some new fancy idea to dismantle the Affordable Care Act. We will not let that happen. We will not. I want to close with a story, and it's not my own story, but it's a story of a close family friend. And just 2 weeks ago, this young man who had been unemployed, and so had been receiving unemployment, and his insurance had run out, and then he just got a job. And when he got this job, he then became sick. He had maybe been on the job for about 2 months, and he got really sick. And he didn't think of himself as an unhealthy person. He was rushed to the emergency room. It turns out that he has diabetes. He's a diabetic, and he didn't know it. All of his vital systems started to shut down. He has 3 young children and a wife. And because he had only been on his job for 2 months, he didn't have health insurance. And of course, he's not 26, so he couldn't be on his parents' health insurance plan. He's not 18, so he couldn't have pre-existing conditions taken care of. And I think that when I think about why it is that we need an Affordable Care Act, it's for people like that who fall through the cracks. And he happens to be in a state that is not implementing. It's the state of Texas. And for this young man and for his family, had he not had the backstop of some other family members in the short term to try to meet some of the at least initial costs, it's not really clear what happens to him. Right now, he was released. He's now back on his job, thank goodness. But it could have been a much bigger disaster. He could have lost his life. No one in this country should lose their lives because they, even though they may not be feeling so great, they decide not to go to a doctor or visit a hospital because maybe they're unemployed and they're uninsured. Nobody should have to make a choice like that in this country. And you know it, and I know it. Under the Affordable Care Act, we recognize that, and we're going to make sure that can we say this, hell or high water, we are going to protect the Affordable Care Act. We are going to defend the Affordable Care Act. We are going to implement the Affordable Care Act, and then we're going to use that as a platform for radically changing our health care system so that it works for the American people. Thank you very much, and good luck to you.